welcome everybody to another round of colorectal surgery virtual education. This is one of our transition episodes too, so we have some of the new crew that are on, and then they will start hosting in the near future. But today's kind of a special panel for everybody that's just starting fellowship and those that have wrapped it up. We're going to do just kind of things going in and just general tips and tricks for fellowship. So I'm going to let the panel introduce themselves, name where you did your fellowship, where you're going, what your plans are, and then we'll start with some questions after that. So Carrie, you're at the top of my screen, so I'll have you go first.
Okay, great. I'm Carrie Lopez. I grew up in Miami, did med school at University of Michigan, my general surgery training at University of Maryland in Baltimore, where my husband and I sort of settled down and had our 2 kids here. And then I did my fellowship at UPenn in Philly and came back to the University of Maryland for faculty, and I'm starting in September. And one of the things I'm super interested in is research sort of in the microbiome and anastomotic leak and biomaterials. And so I've been working on trying to get that stuff all up and going in the last year or 2. And yeah, so I just moved back home and I'm currently in my basement and yeah.
Cool. Master, you're next.
Hi, everyone. My name is Mazar Kamara. I am originally from Northern Virginia. I am Michigan trained, though. So Michigan State University for medical school, Detroit Medical Center, Wayne State University for general surgery residency, and then Trinity Health Ann Arbor, University of Michigan for colon and rectal surgery fellowship. I am still working on what I'm going to do next. So I'd love to talk a little bit more about job searching and things of that nature. And I am interested in medical journalism and patient education. And I really want to use both social media as well as written word in order to increase health literacy when it comes to diseases of the colon, rectum, and anus.
Julia.
I'm Julia Nugent. I grew up in North Carolina, went to UNC Chapel Hill for medical school, then made it to the Midwest for training, did general surgery residency at the University of Minnesota, and then just finished fellowship at the University of Wisconsin in Madison. I just came back to Minneapolis, just moved back yesterday for a job in private practice on the west side of the city. My main interest outside of clinical practice is teaching. And so the University of Minnesota residents come to the main hospital that I'm at as sort of a satellite site. And so I'd be happy to talk about teaching and fellowship, how to get a job that's kind of hybrid teaching after, anything like that.
And then I'm Stevie J. I am originally from California and then did med school at Michigan and did my residency at Trinity Health in Ann Arbor, and then sorry, my dogs are very excited. We're back in my house. And then did my colorectal surgery training at University of Alabama in Birmingham. And now I am back in Michigan, and I'll be starting my attending job at Trinity Health in Ann Arbor in October. So with that, just first, I would love for everybody to share I steal this phrase from my husband, but some roses and thorns of fellowship. So roses, good things, thorns, bad thing. And Julia, we'll start with you.
I am in the roses phase of remembering fellowship. So I have a lot of roses. I actually have little pictures of all of my attendings because they would put them on the patient rooms. And I took some from the hospital. Don't tell anybody, because they inspire me. So I think my roses are probably the staff that I worked with, because I learned so much at the University of Wisconsin. We had 8 staff. And so a lot of different ways of doing things, trained everywhere. And so one of the roses was working with all of them. They were fantastic and we had a really good relationship, and I got to learn a lot of different things. I think the thorns, similar to residency in some ways, there are a lot of asks on your time in fellowship. And with 8 faculty and me being the only fellow, that gets a little extra challenging, I think. So I think the hardest part, or the biggest thorn for me, was trying to balance things in fellowship, like finding a job, doing my clinical work, what that actually meant to do my clinical work, learning on the outside, and then doing all of the extra like administrative or teaching things that I was doing.
Awesome. Thank you. Nazare?
I would say roses would be, I had a really unique experience where on the one hand, when I'm at Trinity Health Ann Arbor, it's more of like a hybrid community academic setting. And then when you go to University of Michigan, it's like very hardcore academic. So the Roses was definitely getting to see not only the different practices in those different clinical settings, but also, figuring out what works best for me and where I thrive. So that was a amazing rose. A thorn is, I think, the job search process. So we are so accustomed to everything is kind of just mapped out. Like, you apply to medical school, then after that you apply and you match for residency, and then you keep on going through the process, and there are deadlines and things happen on a certain timeline. And I think for the job search here, it's just like, it is not on a timeline. There is not a deadline. There are a lot of things that you have to do in order to secure your job. So I had advice earlier on in the year that was like, oh, don't worry about when you're applying for your jobs, like it will come and things like that. But that is not necessarily true. And I am here to tell people, start searching now. And there are many ways that you should be searching and looking for your next opportunity.
Thank you for sharing that. And then we'll talk a little bit more about job search stuff later too. Carrie?
Roses, definitely. I mean, I agree with Julia. I think right now I'm Rose's lens, and I think for me, one of the perks of fellowship was really getting to know all the faculty really well and being able to spend so much time like with just a smaller group of people and really learn how they practice, how they operate. And I think like forge some relationships that will be lifelong for me, both with faculty and with the residents of the program too, which I was sort of like was an unexpected benefit, I think. I think the volume was great. Being able to do what I wanted every day was great. Having my pick of cases is great. The flip side of that was I think there was so much volume for me that I was not expecting to have so little time to like read and prepare. And so I'm planning on, I think, spending some of the next coming months really like catching up on all of the CPGs and like the things that I sort of expected to do during fellowship, but I was just so busy operating that I feel like I just need to catch up with myself a little bit. But I mean, I think fellowship was a fantastic year, but it goes really, really fast.
Yeah, I'm in the exact same boat as you. Just the sheer volume, I think, was hard to manage sometimes, but I'm also very grateful for it. And faculty also, all of them were amazing, and love them all 7 of them. I'm going to call them all for different things, which I've already told them to be prepared for. But yeah, I think the year does go by really fast. Time management was much harder than I expected, especially after coming from residency, where I thought I kind of had that part figured out. And it's a busy, busy year. And I think with our volume too, it was also harder to get to some of the like not required clinics sometimes too. But moving on, we have another question from the chat. Do you have any recommendations in regards to contacting programs? So it sounds like interview season related, that one is interested in and you don't receive an interview from there. Is it appropriate to send an email of interest? Any of you want to take that?
I mean, I know that I used faculty to sort of reach out for me for the programs I was most interested in, but I can't really speak to how that works for other places.
Yeah, I'd second that. And I do think it's okay to send an email of interest, because the worst you're going to get told is no. I don't think anybody really cares if they see a second email and they don't want to deal with it. They'll just be like, yep, no thanks, and delete it. So I think it's okay to send. You want to be brief and you want to be very professional, and you may want to have faculty from your program, from your residency, follow that up and be like, hey, because that probably means a lot, maybe even more than an email from you, honestly. But I think it's fine to send that. I would also do faculty too, though.
Yeah,
And
I would do the same thing.
And if you're sending a personal email, you should probably have like an update from your application also, something new that you might be trying to share, because otherwise they just got your application materials. And I agree with the others. It's better to have faculty kind of speak on your behalf at that point.
And I do think there are waves of interview invites too, because I feel like this is about the time where a bunch of them started coming in. And I know there were like some programs where I saw, I feel like every class has a spreadsheet where they update interviews that have been sent out. And there are some where it's like, oh, that one already went out. Like, guess I didn't get an interview there, but then it would come like a couple of days later. So I think just every program kind of reviews applications differently. It's different from residency where like you're interviewing them too. So just remember that. And you want to just make sure you end up at a program that's right for you. So I think, yeah, I would just second everything people said too. I guess any other tips for interview season while we're on this topic?
I think really know what you want to get out of fellowship and sort of what your primary goal outside of just training is. So if you want to develop like relationships in, the like the research world, or if you want to meet people who can help get you involved in ASCARs, or, sort of have things that you would like to talk about and that you're sort of can use your interviews to sort of both demonstrate your interest in something, look your faculty up ahead of time, sort of know what people's outside interests are so you can actually have like a productive conversation.
I do also
That is
think, yeah, it's very good. The faculty sort of, when they interview you for fellowship, expect you to have something meaningful to say about what you want to do in colorectal surgery. And that could be, I want to go into private practice. And that's it. And it's really important to be true in your interviews about what you want to get out of your fellowship, like Carrie's saying. And so I would have like practice saying that, what you want out of a fellowship and why, and what you hope that fellowship will get you, because that'll get you that really good match. Because there are so many different types of colorectal fellowships, I think all do excellent training, but they get you kind of different things because it's such a fast year. So I think it's important to really know what you want and be honest about that, because there are so many different ones that like, there are ones that will not be a good fit with you, and they know that and you know that, and that's okay. You will have plenty of options.
Yeah, I think like it's past the point where you should say what you think they want to hear. It's a small community. People are going to know what you want to actually do. Like, I think
Don't say you want to do research if you don't want to do research. Don't say you want to teach if you don't want to teach. Like, it will bite you in the butt. Don't do it.
Yes.
Say what you want to
Yeah.
do. We'll love you for it.
Yeah. It's like the first time in your life that you also just have to kind of be honest with yourself and what you're looking for. And it also just doesn't, like, some of the stuff that you needed to get into a residency, it just doesn't matter anymore. Like, this is like, you need to do the best training for your job. And I was trying to think if there's anything else about interviews or interview season. Oh, I know. So it's with Zoom interviews. I know like our class didn't really, I think all of us probably still had in-person interviews for residency. And with Zoom interviews, it's great because you don't have to travel anywhere, but just I would just suggest, if you know you're not going to go to a program, don't just take the interview, because there is somebody that probably would like that interview. And programs don't interview very many people. So just kind of be conscious about that. And it's okay to say no to interviews also, because it opens that spot for another person. All right, moving on. So another question that kind of was brought up was what you did for board prep and how you balance studying for boards with fellowship, and whether you took them in October or March, and how you think that, I guess, how you think you had to adjust your schedule based on that. I know for me, it was in a case when it opened up to sign up, I really wanted to take mine in October, but within 4 hours, all the dates were picked. So I had to take mine in March. I used surge boards, highly recommend. And yeah, I think I started really like settling down to study in January after the new year.
Yeah. I
So
use SurgeBook as well. I think that's a very, very good resource. But then I also did Behind the Nice, and I would listen to those podcasts if I was in the car or driving somewhere. And then I did a crash Osler session, like, 5 days before my exam. I did like the whole 30-hour course. So I would recommend, spanning it out. But though I used all three of those resources and it worked well.
Yeah, I did Behind the Knife and Osler too. I also had to take it in March, and I wish I had taken it in October, because I feel like it really just spread out the duration that I was stressed about it, and like reading about thyroglossal duct cysts while I really wanted to be preparing for cases was like really a bummer. But I mean, it worked fine. I did okay, and I mean, I passed, and I wish I had taken it earlier, but it was all ultimately fine.
I also took mine in March, but I'm very glad that I did. I was really, really stressed at the beginning of fellowship. It was a big transition, even though it was geographically close. It was just a big transition. And so the first probably like 3 to 4 months of fellowship, I felt like my brain was on fire all the time. And so I think that would have been hard to add board prep for me. But I know a lot of people who liked doing it earlier because you like get all that general surgery stuff out of your brain and you don't have to keep worrying about paraglossal duct cysts. That said, I alluded to struggles with time management during fellowship. So I talked about that with my program director when I was prepping for oral boards and was like, I cannot do all this stuff. And he was like, why don't you just take every Friday? And if there's not an index case, you just study for boards every Friday for like a month. So that was really nice. So I encourage you, if you're having struggles, to like come up with creative solutions, because everybody really wants you to pass your boards. It looks really bad on them if you don't pass your oral boards. Also, maybe don't be like me. I really only did behind the knife. And then I practiced a bunch from, I have to look at the book. I'll find it. How to Win is the other book. And so it was just a lot of like practicing running through stuff for me. I don't think that probably is sufficient. I felt really freaked out going in. It ended up being fine. So if that's all you do, remember me and say it's probably going to be okay. But I encourage you to be creative about your time with that, because it can be really stressful in March, because that's also job hunt time.
Yeah. And I think
Yes.
practicing is really important too. So just like what you were saying, I would, the week or so leading up to the exam, in the evening, I would practice with a co-fellow from another program, and we would just get on the like phone and give each other board scenarios. And then I also reached out to attendings both from my residency program as well as from my fellowship that would give me scenarios also. So I think like doing as much practice and thinking on your feet is very helpful to taking away from the stress from studying for it all.
Yeah, the night before too, one of the other fellows, Hande and I, we both did surge boards, and so we just like looked at the list of topics from there, and then we just went through like 100 scenarios essentially, and was just like, do you want to talk about this one? No, okay, next one. Like, do you want to just talk about this one? It's like, oh yeah, briefly, like let's review stuff about hypothermia, like, and just kind of talked everything out, and it was like 2 hours, but it was ended up being super helpful just to kind of get those like last minute jitters out. The other thing that I wanted to say, so October, so there's like different stresses for the time frames. So March is like job hunt time, and then October there's the car site, so it's like ab site, but for colorectal. There's your like ASCAR's deadline, and I feel like there's one other thing that also is pretty early. I mean, just starting
The
fellowship in
career
general
course.
is
Yeah,
November, I think,
travel, yeah.
right? Yeah.
Yeah, I think it was
Yeah, all those
all
things.
together. Like August,
Yeah.
you're just trying to survive. In the
Mhm.
fall, you're doing car site, the career course, submitting for ASCARs. And then winter, you are applying for jobs very heavily. And then spring, you're like, oh my gosh, I'm almost out of here. I better save all the preference cards and all the clinic notes.
Yeah.
Yeah.
Deadline, I
Yep.
think, is October 15th this year. I don't know when oral boards are, but I feel like they got to be early October. So that's always a little tight.
Yeah.
Yeah. But then in March, you're trying to operate your butt off and you're
Mhm.
hunting for a job and you're probably interviewing for jobs. So you're missing cases for that. So it's, like Stevie J said, really different stressors.
Yeah. So since we're kind of talking about the job search, everyone can just kind of give their experience and general advice. Carrie, will start with you.
I mean, I came into fellowship knowing I was pretty sure I had a job in Maryland that I was coming back to, but I think what I found really helpful was sort of talking through what I wanted my career to look like, working on what I needed to ask for, and like really hashing that out. And I think I got a lot of support from my fellowship attendings with how to do that. Happy to talk more about it. I also would recommend like trying to get a cover letter ready early, because it actually like takes a little while to like sit down and write out like who you are, what you want. I ended up asking some like of the more junior attendings for examples from theirs, and I sort of based mine off of that. So I think that's something you can start working on early. But yeah, I can't really speak too much to it otherwise, just because I'd been working on setting something up in Maryland for a while.
And then because I know with your like research and everything that you want to do, I know you're kind of setting it up through Maryland, but how did you like express your research interest to them and make sure that you got what you wanted for research?
I mean, my mentors at Penn were really essential for that because that's what most of my negotiation ended up being, like how my contract was going to look. And I ended up essentially taking a contract where my RVU bonus was protected for 2 years. That would give me 2 years to essentially get funded, and then I'd be able to renegotiate. I currently am at 30%, but up to 40 or 50% time protected, depending on what I'm able to sort of get as funding for my first 2 years. And then I also negotiated my startup package, which I was able to take from a small amount to a pretty large amount with some help from Penn. And, Maryland really working hard to sort of come up with different pockets of money for me to get started with. And I actually used fellowship a lot to like refine my research goals and start writing my first few grants. Like I actually wrote 2 grants in fellowship with the help of some of my attendings there. And I just a plug for ASCARS has like an actual research meeting second Tuesday of every month called Create. That is like a incredible resource where you can essentially like write a specific aims, present them to some of the biggest names in colorectal academic research in the country, and they will give you guidance and sort of help you reformat those. And I found that to be really invaluable. So I really used my fellowship time to sort of refine that, and that informed my job negotiation at Maryland too.
Awesome. Thank you for sharing. Julia?
So I started the job process hunting probably a little later than average. It was like December when I got out all my cover letters. It ended up being just fine. I will also say I interviewed at, I think, like 5 places, which all my faculty told me was a lot in comparison with what they did just even the year prior. One of our new faculty was like, I interviewed at 2 places and got this one. And so I came here. And then I ultimately came back to a place that I kind of knew in residency wanted me back. And I'm very excited to be back, although I'm not sure it would have been my choice had I gotten one of the other jobs, just being quite frank. So I think that said, it's all going to work out fine, but it is a little challenging. And I think I will warn you all who are coming in the next 2 years. I think a good thing for you all, a good warning, is that I think what's happening is that our class got all of the people from COVID who had their first round of jobs that they didn't love are like now 3 to 4 years out looking to transition in their sort of junior attending. They've gotten out of their initial contract. And so there was this big influx of like a lot of the jobs that I lost out on, like 3 of them went to people who had already been in practice for 3 to 4 years. So I think for the people who are on this call, the interviewees, and the current fellows, you're going to be fine because everybody's sitting in a contract for a couple years. So I think there's this sort of leftover from COVID that we're seeing every like 3 or 4 years. We're going to see this weird little cycle for a little while. That said, I really enjoyed going on interviews. So I went on a lot of them because I, liked making connections and I thought it was very interesting. And what was really important to me was teaching. And so I just made sure that every job I went on had some aspect of resident or fellow education, and mine still does. And so I'm pretty pumped about that.
Can you just describe a little bit like what an interview day looked like, how much time you needed to take for it?
Yeah, so most of mine were for private practice. I had, no, they were 50-50. I had a couple that were academic. And so on average, they were a day or a day and a half. And so I ended up taking 2 days for most of them because of travel. My faculty were very understanding, the whole team was, and me just being away for 2 days at a time. And then I found them not nearly as stressful as fellowship or residency interviews, but much more formal. There's one that you have to give a talk at, and I don't think that's common, but if they ask you, don't be worried. And you meet a lot of different people, like you meet all the PAs, you meet all the faculty, you meet a bunch of admin people. And so it's a little more like trying to bring you onto a team, which I thought was very interesting and fun. You should meet the clinic staff. If they don't have you meeting the clinic staff, then you should ask to meet the clinic staff. So I'd say on average, I took 2 days.
Nazare?
I would say just starting with resources. So it sounds like all of you had what I think is really good, that you're coming into it and you already had some connections about what jobs you might be able to take. But I think for me, it was the career course is where after that time, I went ahead and like wrote my cover letter and submitted my applications. And the resources when you're looking for a job. Number one, you always look to your fellowship leadership, and they can make calls and send emails and look for open positions, because what you find is you might do a search and go on Practice Link or Practice Match, and those jobs are already spoken for. Like there is someone that is already, they're just officially posting it, but there's someone that's getting that job already. And I think what Julia said also happened a lot, at least for me. So, I went out to like 4 site interviews, and you think your previous faculty tell you if you go to a site interview, usually you have a pretty good chance that this is going to be your job. But you go to these site interviews, and then there are people that have 5-7 years of experience or more, and they will get the position over you, unfortunately. So I think that one thing is just make sure you talk to your faculty early, especially if you want to go somewhere in a different geographic area than where you might be. The other thing is like use Practice Link, use Practice Match. You will see a lot of different positions, but also look at the trends. There are some jobs that have been open forever, and there might be a reason that that's happening. And the other thing is a lot of those websites will link you with hospital recruiters, and just get ready to get inundated on your phone with updates about different jobs and things like that. But it still just allows you to see what's available. And I would just say start as soon as possible, especially like if you have a geographic restriction or any other restrictions that you're thinking about, start as soon as possible. It's never too early. Like for people that are currently interviewing and you're in residency, start now.
Awesome, thanks. And then I signed a contract before fellowship, so I was in kind of a little bit of a different boat, but it was nice going into fellowship because I knew kind of the things that I wanted to do to be able to contribute to the practice differently and to sort of build upon like the niche that I want to have. So again, just like really think about what you want, because this is the time where it really matters, and you want to pick a fellowship where you can get to those places. Okay, other things that were on the list. Did anybody have trouble getting their numbers? And if so, in what, and what did you do about it? I did not. So I will leave that question to somebody else, maybe.
I weirdly had trouble getting fissure. Okay, so really quickly, for logging for colorectal surgery fellowship, there's the procedure that you do, just like general surgery residency, but there's also a diagnosis that you have to associate with that procedure. And so you have to see a certain number of various diagnoses like IBD or cancer or whatever. I weirdly had trouble getting my fissure diagnoses because our PAs do so much of it in clinic. And I just didn't prioritize it. And I like got all my cases for fissures, no problem. Like I did Botox, I did LAS, everything was fine. But getting the fissure diagnoses to be seen, I like kind of scrambled at the end going to clinic a lot. I think that was totally my own fault. I could have just spent a day with the PAs in clinic and gotten in. But I think it is important to pay attention to both the case numbers that you need, but also the diagnoses when you're starting out fellowship, and kind of keep an eye on all of that. Because it's easy to have a little thing like that where you're like, oops, I guess I missed seeing the 15 fissures I'm supposed to see, and I got my 5 cases.
Yeah, I similarly, the number that I had a hard time getting was just my intervention, my colonoscopy interventions, because I like never wanted to skip good cases to scope more. It was like available. I just had to make sure I was constantly keeping in mind, okay, I should go do another scope day and like skip the LAR today or something like that. But
Yeah.
Yeah, I didn't have any problems with numbers, which was phenomenal. But I think one thing you should do is talk to the previous fellow and just see what were the things that you struggled with at that program, particularly. And a lot of times it's not because you don't do them. It's just that you didn't, like what everyone's saying, you don't make that focus to go to the clinic, go to the pelvic floor clinic or whatever it might be, so that you can make sure that you see all the things.
Yeah, and also I know one thing that like my fellowship program director did was at the beginning just be like, hey, just so you know, like sometimes fellows have trouble getting hemorrhoids like numbers or getting their scope numbers. So just make sure you're like paying attention to those things. So I just made a point to kind of check everything consistently. And then when you're when you're logging for diagnoses too, the other tip for if you're like seeing a clinic patient, there's another part that you have to put where it's like no procedural intervention or something. So you end up being able to log it correctly. So you have like your diagnoses, and then you have this other thing that you have to look, that's where you would normally do the procedure. So just make sure to keep that in mind. And like for me, like when you discuss patients too, like sometimes those are things that you can log. So like we had an education day where we went over some pelvic floor stuff, and we like talked through patients and talked through things that were coming up. And there's like ways you can log those discussions too.
Yeah, I would say for tumor board too. For
Yeah. Oh
tumor
yeah.
board, I would always just log those as no pelvic floor conference,
Mhm.
log those as no procedure because we're discussing the patients.
And there are like little
Exactly.
tricks about how to log things, like that's one of them. There are certain things, like if you read anorectal manometry, I never did any, but we read it, and so that counts for pelvic floor evaluation. So
Mhm.
definitely, I agree, talk to the fellow or fellows from your program to see what tips they can give you about how to log, because there may be things that you don't really realize count.
Yes. Those were some of the prepared questions that we had. I don't know if Jordan or Joyce or Karishma have any, since you're on the call and are new fellows. So if you have any questions, please feel free to ask them. Otherwise, if anybody has just anything that they can think of, something they wish they knew, or just general advice, I know go for it, Carrie. Yep.
Oh, I mean, I was just going to talk about our chat, and
Yes.
if you were planning on bringing that up. So a lot of fellowships are obviously like 1 or 2 fellow programs, and a lot of us just sort of formed a chat. I remember a year ago, I texted like the interview chat, and I was like, hey, I'm going to be the only fellow at a program. Does anybody want to keep in touch? And somehow we ended up with a group of like 30 people, 30,
Mhm.
and we text most days, I would say,
Yeah.
about anything from cases, oh, you're frustrated, being at a new program, frustrations with that, the job search, everything. And I think it made a huge difference to like have that support throughout fellowship for me. So just a plug for if you guys, I don't know, if you're at single fellow programs, I would just recommend like trying to find a group of other people to stay in touch with, because it's been really valuable.
Yeah, it really, really helped, because I mean, some people want to be in a multi program just because they want to like be able to commiserate or be able to like express all of those things. And we just found a safe place within a chat to do that. And then I know for me personally, I wanted to be in an only fellow program. If there's anybody on here that's currently interviewing, I my mental health, it was just going to be easier to not like be comparing myself to my co-fellows. That's just what I know about myself. So if you are currently interviewing, just something for you to think about.
Yeah, I loved being an only fellow.
Same, only child, loved it.
And
Very
like,
emotional for me. Yeah.
and also like I was somewhere where there was a really busy residency, and so there were plenty of people for me to like hang out with, and who were willing to help me out if I needed help. So stay open-minded. I think single fellow programs are great.
Yeah.
Yeah. And I would even say going to the residents are your resource. When you get to this new place, I think one of the major transitions is in residency, you were with your attendings for 5 to 7 years, depending on what program you went to. You knew these people, you grew up with them. But here you're coming to a completely new place. You've never worked with these people. You don't know their quirks or what they like, what they don't like, how to get on their good side. Use the residents. Like I had phenomenal residents support. So shout out to Trinity Health residents. They are amazing. That really kind of like show you the ropes, show you how things work at their institution. And it really helps with the transition. I think they're great. And then also just look at who the key players are. For us, we also had a very robust PA, like robotic PA team, and getting to know them, working well with them, and understanding how things work at that hospital can really help with your transition from going from being a resident to a fellow.
I think I'll talk about the transition. I had a really rough, like, first probably 4 months of fellowship. It lasted a lot longer than I thought it would, because I was like, this is only a year. I should be better than this by now. And I think part of it was that I had just heard from so many fellows from different places that like this was the best year of your life and everything is wonderful and like everything is great and you get to do exactly what you want and it's the best year ever and nothing is wrong. And that was also true. I had a great time. I learned a ton. I got to do colorectal surgery all day, every day. Everybody was wonderful. But I think there were a lot of things that just made it really challenging. The change in the role, the change in location, and then just being more engaged and involved in cases and feeling more ownership over patients and cases was challenging. And so I just want to tell you that if you're struggling, it gets better and it does eventually click and you can operate and that's fine. But if you like have a couple weeks or a couple months where you're like, what did I do? I can't do any of this right. It will be okay. Someone told me that after 4 months, I went to one of the faculty and I was like, this is not working. And they said, it takes 4 months to click. Don't worry. And I was like, no one told me that. So it might take 4 months to click. Don't worry.
It might take 6 months for
Might take
some
6
things,
months.
and it's
Yeah,
okay.
depends on what it is.
Oh,
Yeah.
totally. I mean, I felt the same way. And I remember going to my program director and being like, oh my God, at about the 4 month mark, like, I'm not ready to be on my own. He's like, well, it is a year long, Carrie. So
You're like, yeah, but we're a third of the way through. How am I not a third of the way ready? It's like a weird exponential thing that happens.
and I think that's also where the fellow chat helped me, because like every now and then I'd call someone and be like, wait a minute, do you think you could do this on your own yet? And he'd be like, oh God, no, I'd be terrified to do that on my own. It's like, okay, all right, I'm not completely alone then. So
Yes.
yeah.
I think
Totally normal feelings.
one thing that I think also helps with just like speeding up the process of learning. I started doing a lot of video review at the end of the year, and I wish that I had done that throughout the year. So not only did like your robotic cases are recorded, but then further just reviewing it with either the faculty that you did the case with or a completely different faculty. And what I found very helpful was just like, you can put things on pause, rewind it, rewatch it, and really
Hold
look
on. Speaking of pause and rewind, you just cut out for this whole thing. I'm assuming you're talking about watching recorded videos of yourself operating.
Oh man, yes. So sorry,
Okay.
can you hear me now?
Yeah.
Okay. Yeah, so I was just saying that video review is very, very helpful. I would record all your cases and try to review it with either the faculty that you did the case with or another faculty member, and really like get really down to the minutia of your technique. I think it helps you grow exponentially. The other thing is there are some scoring systems like the gears and the gas systems that I believe were piloted from like the program directors committee, but those are also helpful that you can just get very objective evaluations of how you are doing and where you are. And I think that's something that I would recommend highly.
I had a question. So I'm an incoming fellow. My name is Jordan. I wanted to just ask what resources you guys used kind of to prepare for cases besides before you build up your video case log.
So I still the same stuff that we kind of did in residency. When I was first starting, I looked at all of my attendings' op notes too, just to see if they did anything a little bit differently. And then I also, if it was like the first time I was doing a case with one of them, I talked to them about it first. Because in my program, they ran 2 rooms. So, almost 100% of the time, you're at least getting the case started by yourself, even your first week or so of fellowship, which was new for me and it's just not how my training was. So that was great. But I just had to be, I think, a little more prepared to do stuff on my own than from the very start than I was anticipating. And then I started looking at some of their recordings. We got like a flash drive of some of my program director's robotic cases. And then otherwise, I just usually talk to the faculty. And if it was something I never did before, then I would either read like Ask Ours or the Cleveland Clinic book. And if there are any videos online, then I would look at those too, if I had time.
Yeah, I read a lot of op notes, I think. I've never been a big video learner. I wish I was, because Mastery, I think it's such a good resource. But so I read like Zollinger's and then my op notes from this faculty from previous to see how they did it. And then if it was something I hadn't done before, I couldn't find, like, we did a house flap and I tried to watch a video and I was like, this doesn't make any sense. So I just went to my faculty and I said, I've tried, I've never done this before. And were very patient about being like, let's just walk through it. Like, we'll kind of guide you through, as opposed to, like, I think different from USDBJ, and that they were much more hands-on for much of fellowship.
I will say, like, one of the things I wish I'd done more of was like take notes sort of like on cases as I went, like, oh, this person did something that I did that sporadically, and now I'm like, why didn't I like put more effort into just like putting a few notes down? Because like I kept a case log And I usually try to like jot something down. I don't know, I think that would have been more helpful, just going back to jog my memory on cases, but
Thank you for bringing that up. That was something I think Ari Cantor's talked about at our career course, just like going in, looking at like what instruments are being used, and then as soon as you finish a case, like jot down as many notes as you can about it. I was very good about it for the first like 4 months of fellowship or maybe 6 months of fellowship. And then after oral boards, I experienced a burnout unlike no other. And I started doing it a little bit less. And then, kind of like the last month or so, I picked up the habit again. But it was super helpful, especially just kind of like flipping through my notebook and being like, oh, yeah, I just did this case, like with this attending, like what did I write down about it from last time? And sometimes I wrote down things like why didn't you do this, like dum dum, or because that's just helps me jog my memory about the case, usually just focusing on my mistakes or critical failure.
So I do think it's weird. We had a conversation in our group chat way into fellowship where people were talking about for ours where you put your ports. And it got me thinking about how little variation we had in my fellowship because someone said something and I was like, whoa, I've never even thought about putting my ports in that place. And so I think that getting really nitty gritty about the details of the case, and you can even have like the circulator or the OR control desk like has case cards for everybody.
Mm-hmm.
They'll print them out for you and they are gorgeous because they have actually like the not serial number, but like the catalog number of everything that people use. So if you, I wish I had done this. I realized the very last month that this would have been helpful. If you have them print that out, you can make all sorts of notes on it. You have it for later to bring to your eventual job and say, this is the grasper that I want right here. These are the ports that I like. And so I think paying attention not only to the dissection itself and making sure you're actually seeing the planes properly and making good decisions intraoperatively, but also those details about case setup are really important. That might be something you do the last half of fellowship. I don't know. It's different. Don't feel like you have to do everything all at once for every case, but
Yeah.
things to consider kind of with each case.
Another question that came up is just what were your other responsibilities during your fellowship? And then I know we like talked a little bit about time management with like case prep, or if there's like education prep or tumor board prep, and just other things that you guys were like forced to spend your time on.
I didn't really have to do like tumor board. I think I was on home call every night and my service was very busy and like it was typically a pretty busy service. So, and like you mentioned, Stevie J, like we often had 2 rooms running, so there was like not a ton of time between cases. So I just feel like the volume made it a little more difficult for me to prepare the way that I ideally would have. But fortunately, I wasn't, my education didn't require me to do much work. So it was really just case volume.
Our education was broken down by week. So, like, the first week was indications, complications. The second week was like inflammatory bowel disease, where we met with GI. And then we had pelvic floor conference, then journal club. And if there was a fifth week in a month, then it would kind of be up for grabs. So, preparing for those could be it's just an extra thing on your plate that you have to do. And I would say that for me, Tuesday was always really busy because we would have our education you come in and you round, have the education in the morning. And then I usually had like some admin time, but then you would go and do tumor board, fellows clinic, and then usually more clinic afterwards. So just sometimes there's a lot of things that you're juggling at one time, but it really helps prepare you and it lets you see, a broad range of things in colorectal. So I thought it was overall very good, but you can be very busy.
So I had one nice thing is there wasn't a lot of non-educational extra work. So I didn't have to make OR schedules. I wasn't on, call schedules, anything like that, which we did a lot of in residency, but I did have to run our Friday morning, like hour-long education session for our service every Friday, which took a lot of time because I cared about it a lot. I think it was good because I now have this like, wealth of talks that I've made that are ready to go. So that was a good bit of where my time went. And then we had tumor board once a week that we prepped for. And then that there has to be something else, but that kind of feels like it now that I think about it. Every now and then I would give division or departmental M&M But that was, I think, 3 times throughout the year, so not that stressful. So mostly clinical stuff or directly related to educational things.
Yeah, for same thing, like ran tumor board and then had to prepare for education, which sometimes happened, sometimes didn't. The times that it didn't happen, it was usually because all of us were still operating. And I think that our tumor boards were very busy. So it was something that, like, if I didn't spend some time on the weekend working on it, then my like Mondays and Tuesdays were just awful because Tuesdays was our busiest OR day, and then Wednesday was tumor board and education. So I think just trying to, like, as much as I hated spending time on the weekend doing that, it was just something that I had to do and to stay afloat and stay ahead of everything. Let's see, I guess Joyce or Jordan or Krishma, any last minute questions as we're kind of wrapping up here? Anything you guys want to know?
Yes, one question that actually came up. Thank you so much, all of you, for taking the time to speak with us. I'm Joyce. I'm one of the new fellows at OHSU. Since the CRS deadline comes up so quickly, how did you all kind of like figure out your project and make it doable before the submission deadline?
I was just told, hey, this is the project that you're going to work on with one of the residents. And that was the abstractor.
I was lucky because my program director kind of started that even before I started fellowship. We already started talking about the project. So that was just easy to continue that on.
I had a similar thing. Our research faculty that kind of leads it came to me and said, here are 2 projects you can pick from. They're both relatively ready to be written up. There's a little bit of work, like chart review, to do on both of them and a little data analysis, but very reasonable to do within a month, even with starting fellowship. And she was like, pick one. And I picked one and then wrote it up. So I think you kind of have to be handed something. And your program, if they haven't told you yet, you can ask them and they will probably have something kind of ready for you or some thoughts. I mean, don't go into it saying, like, expecting that they're going to hand you something, maybe have some ideas, but they probably have some stuff that's in progress that you can kind of latch on to.
Carrie might have been running a lab already. I'm not sure.
She already
Probably.
And
she was ready.
I would, if you like have aspirations to do something, it's like helpful to want to collaborate with. So I got in a very preliminary abstract with some Maryland collaborators, but Penn had like a project in mind for me. So I think that's sort of the expected thing, is that they're going to help you put something together because that timeline is so short.
It's kind of crazy. Yeah.
I think you guys touched on the majority of my questions, but I did want to say thank you again for kind of sharing your evening with us. And I know it's a busy time moving because we all just moved. So thanks again.
Good luck.
All right.
It really is so great. You're going to have so much fun.
Yeah, good luck.
Yeah.
Fast year, but you learn a lot.
Learn so much.
Yeah. And if anybody has any other questions at any time, just feel free to reach out to any of us. And with that, thanks everybody. Hope you have a wonderful evening. I really appreciate all of you being here tonight. And Krishna, Jordan, and Joyce, I know you guys are gonna take colorectal surgery, virtual education to next level. I'm really excited for you guys, and I hope that you all enjoy it and enjoy the year. All right, have a good night, everybody.